Assalamu alaikum, you're listening to Unity FM on 93.5, the heart of the city. My name's Ibrar Khan. It should be said that any health advice given on this show or any other show on Unity FM is general in nature, of course. But if you are struggling this winter, please stay tuned as we do have some important messages coming your way. Now, it's time to talk about those three famous letters, N, H and S. With the winter well and truly having kicked in, the NHS is facing a quademic, in inverted commas, of health emergencies, with hospitals busier than ever, quote, for this time of year, the health service's most senior doctor has said. Professor Stephen Powis, the National Medical Director of the NHS, said he feared the number of admissions would increase further unless the public took action to protect themselves with jabs. Now, that's the national backdrop, but what is the picture like here in the Midlands, and more specifically in Birmingham and Solihull? Hopefully, to try and answer that, we have three esteemed guests. Firstly, we have Natasha Behel. She is a GP from Solihull, and we'll be talking to her about the basics of self-care, benefits of Pharmacy First, and any red flags for parents. Sat beside her, we have Dr. Rif Rashid, a respiratory consultant, and we'll discuss how the various winter viruses affect the body, the picture in A&E, and how one can utilise other services in the NHS. And last but not least, is only because ladies first, sir, we have Ilyas, a community pharmacist, and we'll be picking his brain as to what sort of conditions one can see and treat, and how the army of pharmacists are taking the pressure off of GPs. Thank you all for taking time out. I want to get straight into it, please, if that's okay, now that the Avengers have assembled, as it were. First things first, I'm going to throw this question to Dr. Rashid, please, if that's okay. I mentioned at the top term quademic. What does that mean?
So so first of all, thank you for having me, and it's a great pleasure to be able to speak on the radio station and to reach out to our listeners around what's happening in and around Birmingham and Solihull, and particularly with my colleagues and co-guests around what that means for the patient population and your listener group. So the question that you posed to me was, what is a quademic, which is really a great place to start. So quad meaning four, and demic, I think everybody has some idea of what that means. And the four main viral infections that are causing the strain on the NHS at the moment are flu, RSV, COVID and norovirus. So as you mentioned in your introduction, we have winter's come a bit early for the NHS this year, and as luck would have it, we've got all four of those viruses that I have mentioned in play at various different stages, which is causing a real increase in the pressure on, so from hospital perspective, and also quite a lot of illness in the community, which I'm sure your listeners will be able to relate to.
RSV, what does that mean?
It's like a common cold virus. It's respiratory syncytial virus is what it stands for. So all of these viruses have got very overlapping common features, so they're quite difficult to differentiate to the patient that's got the illness. However, they have various different manifestations. The only caveat to that is norovirus, which is a vomiting virus. People sometimes use the synonym gastric flu, but it's not really typically a flu virus. However, it's much more self-limiting and has got symptoms more associated with stomach cramps, vomiting and sometimes diarrhea.
We're going to go into that a little bit further into the show to kind of talk a little bit about how the norovirus differs to the common flu and how that differs to COVID versus RSV and all that sort of thing. So thank you very much for that, Dr. Rashid. Natasha, I want to ask you a question, please, if that's okay. The National Director of the NHS has recommended that we take a jab, some sort of injection, I'm assuming. Can you tell us a little bit more about the vaccine and why, $64,000 question here, the tough one for you, I'm afraid. Why is the uptake so low across Birmingham and Solihull? What's the problem here?
Thank you. So we know that vaccines are effective in not necessarily preventing you from getting the viruses that Dr. Rashid has talked about, but in certainly how they affect you in your body and how severe you may become ill if you don't take those vaccines. So it's not one vaccine. So there are different vaccines. So the first one is the flu vaccine, which has been around for some time. Anybody above the age of 65 is eligible for the flu vaccine. And then under the age of 65, it's those that are clinically at risk. So perhaps if they have an underlying respiratory condition or diabetes, or there are certain criteria. Of course, health and social care workers are eligible, and children are eligible for the flu as well. Although theirs isn't a vaccine, as in an injection in the arm, it tends to be a nasal flu. And then, of course, all pregnant women are encouraged and are eligible as well. So you've got your flu vaccine, and then you have your COVID vaccine. So often patients ask me, is there not a flu and COVID combined vaccine? And the answer is no, not currently. So it is a separate vaccine. And again, it's for very similar groups in terms of its eligibility. So above 65s, below 65 with clinical risk, not for children routinely, again, unless they are at clinical risk. And of course, pregnant women are eligible. And then this year, for the first time, the RSV virus, which again, Dr. Rashid has just talked about, is being introduced as a vaccine this year. But it's only eligible at the moment for those between the ages of 75 to 79 and pregnant women. It's not for all age groups yet. And there's no vaccine for norovirus, so there isn't a vaccine for that. So this year, for certain groups, you could have up to 3 vaccines. And the idea is, as I said, is that it provides you with that immunity, that protection, that should you be infected subsequently by these viruses, that impact will be much less on you, and hopefully that you don't become so ill from those illnesses. And of course, I just have to throw in there that there is a pneumococcal vaccine and even a shingles vaccine available for those that are eligible as well. And so it is a season of vaccines, but we are very happy to support in your GP practices and community pharmacies with some of those vaccines.
So when one hears that, there are multiple vaccines, multiple issues that potentially, if you're incredibly unlucky, potentially 4 jabs that you'd have to take. Mm-hmm. Is that one of the barriers? I'm just trying to get into the mindset of somebody who might be suffering, coming down with illnesses particularly hard. Is that one of the things that maybe puts a person off? There isn't just one jab defeats it all type of thing. Is the idea of having multiple jabs, or are there other underlying issues here?
So I think, going back to your first question, there is variation amongst Birmingham and Solihull, with Solihull traditionally being better as a community in uptaking the vaccines. Birmingham does lag behind. Yes, perhaps, but just to reassure you that you can have both the flu and the COVID on the same day. You can even have it in the same arm. So I think that's been a huge, that's been very successful for us in delivering vaccines, because before you'd have to come in separately, there needed to be a time lag, but you can have them both now in the same arm at the same time. So perhaps that is a barrier, but as I said, we are here to support you and we want to give you your vaccine. So please do come along to your local GP or your pharmacy, or indeed the many vaccination centres up and down the country to get your vaccines.
Thank you for that, Natasha. Now, I want to turn our heads to our pharmacy friend, Ilyas. Now, I mean, being a pharmacist, I'm assuming you guys are an integral part of the health jigsaw. For a better analogy, can I ask, how are you guys, how are pharmacists sort of taking the pressure off GPs, and what exactly does this program about a pharmacy first, what's all that about?
How we fall into the equation would be, we're the sort of first point of call within primary care. So, somebody gets ill, somebody's unwell acutely, generally the easiest and most accessible route is to come to a community pharmacy, and I think quite undervalued in the sense that people don't understand always what services they can access at a community pharmacy, what treatment they can always get. You mentioned Pharmacy First, so that's something which started at the beginning of the year. That includes 7 conditions, and that is this is a national service as well, so it's accessible all around the country. 7 particular conditions which you can receive treatment that otherwise you would only be able to get on prescription previously. And we like to also make sure people understand that it's only if it's appropriate. So, pharmacists have gone through extra training to be able to provide these services. And we need to be able to triage and ask the patient the same way a doctor would in some regards as to whether the treatment is suitable for them. So the 7 conditions, if I may just explain a little bit more about them. So this time of year especially, you're seeing a lot of sore throats, sinusitis, which are quite pertinent with some of these conditions as well, such as flu and COVID. And you can access treatment for both of those, so you could get antibiotics if the patient was eligible for that. You then also have shingles, infected insect bites, impetigo, UTIs, so that's urinary tract infections, and also middle ear infections, but that's only under 18 years of age. So these are what we call common conditions that a lot of people in the community will suffer with at various times of the year. And it's quite efficient, I think, as a service. I think it's quite novel as well that they've brought this in so that patients don't have to go to necessarily the doctor's surgery, then have to go through the process of getting an appointment. It can be difficult depending on the availability of appointments at the practices, and then have to then go to the pharmacy to be able to obtain the medication in addition to that. So it's quite efficient to be able to go directly to the pharmacy, and in most cases where it's simple and straightforward, they're able to obtain the treatment. There will be instances where it's more complex or the patient has more recurring health issues, and they would then be referred on accordingly. But as a first point of call, I think this Pharmacy First service has been really good in being able to provide accessibility to the community.
So gone are the days where you guys were just putting pills inside a tub and that was it, just walk on. But now that mindset is completely, it's kind of, you guys are now the first point of call, whereas I think a while ago it used to be, the mindset was like, right, GP first, they're my first point, but you guys are now frontline, as it were.
Well, I think that in terms of, from a community perspective point of view, community pharmacy, we've always been able to offer advice and be able to discuss health conditions, being able to discuss medication with people. I think this Pharmacy First differs slightly and it enables us to give more treatment. So that's, I think, the key thing, which makes it a lot more beneficial for patients in the community to be able to obtain and access those services which they wouldn't otherwise. But, a lot of instances, these illnesses are actually self-limiting, and I think people forget that also.
Yeah, thank you. And just to say that if you ring your GP surgery and you ask the questions and we feel that it's appropriate for you to go to Pharmacy First, then we will signpost you to Pharmacy First as well. So you may be hearing about it from your GP surgeries as well.
Dr. Rashid, I want to ask, how do these viruses kind of go about attacking the body, especially those who are deemed to be more vulnerable or immunosuppressed, as it were?
Yeah, so thank you, very good question. And just before I answer that, I think it probably is useful just to say a few words about actually how people can protect themselves. So we've spoken about vaccines, but actually simple hand hygiene, trying to avoid family members or relatives or colleagues that are have got existing healthcare conditions, and using basic, what was it we called it?
Catch it,
kill it, bin it, which was the advertisement from many years ago, still holds a lot of value now. We have to remember that these viruses are very contagious, and for young healthy individuals they can make you feel pretty rotten. But actually, they're the bit where we get worried and where the NHS becomes overwhelmed is where patients who, as you've described, are immunocompromised, which means they've got an immune system that is dampened, or have other health conditions. They may be heart conditions, they may be pre-existing lung conditions, whether that's asthma or COPD. They're at much higher risks of complications from the viruses. And as an example of that, maybe pneumonia or sepsis. So the first port of call, just as Pharmacy First is our first go-to access to healthcare, is protect yourself. And I'm sure the rest of my colleagues would agree with me. So that is simply the first thing we can do to avoid the impact that we are seeing in secondary care, but also in the community.
And in terms of the way that these viruses kind of do affect the body, we don't need to go into it.
The science of it.
Yeah, the science of it. But do you know what I mean? Can you give us a rough idea as to how they kind of go about doing what they do?
So viruses like to replicate. And when they have a way into your body, whether you inhale that particle from somebody else that's coughed it up, is the most common way that viruses enter our body, especially respiratory viruses. They quite like to get in there and replicate and produce loads and loads of virions, which are then what make you feel unwell. So as I say, in a normal, healthy immune system, your immune system will eventually get rid of it. But if you are immunocompromised or have other health conditions, you're not as well placed to be able to avoid the serious side effects from it.
Dr. Rashid mentioned a little bit about self-care, but can you tell us how these, flu, COVID, RSV, norovirus, how these sorts of diseases are passed on? Is it through touching, hugging, air particles? And going back to self-care, what else can we do other than, sort of washing our hands, which I'd imagine is a big one, but what else can you recommend?
Absolutely. So as Dr. Rashid said, it's what we call air droplet transmission. That basically means through air particles. So from sneezing to coughing to being in close contact with those around you that are infected. With things like norovirus, which is more the gastro, the vomiting and the diarrhea. So it's really important again around keeping surfaces clean at home, your cooking stations clean, and again, just that hand washing is the biggest preventer in terms of spreading infection. But also, making sure if you are coughing and sneezing, you are using a tissue. And we don't say this lightly. I think since the times of the pandemic, I think people have become more relaxed about washing their hands or using hand sanitizer. So it's really important to bring it back to the forefront. And I was just discussing with colleagues, I've seen children this week with active infections whose parents still intend them to send them to school, and I've had to tell them, look, I'm sorry, this child is not well enough to go to school. So if your child does have a fever above 38, please don't send them to school, because we're seeing huge swathes of school communities being affected. There are other parts of the country where they've had to shut down certain year groups because they have just been made very ill with these respiratory illnesses. So in summary, it's usually transmitted in the air through the particles. So keeping that distance, washing your hands, and just, being sensible and being considerate of those around you.
Ilya, so I want to ask you a question, please. I mean, in terms of the categorization, what's the difference between a cold and a flu? When does Joe Public kind of think, right, I need to pop in and see my local pharmacist? Because ultimately, if it's a sore throat, you're wasting your time a little bit. A throat lozenge, I'd imagine, usually does the trick. So when does one come out and see you guys at the pharmacy?
Yeah, so I think it varies a lot between individuals. So, you'll find there's some people who at the slightest touch of illness, they feel like they need immediate treatment, whereas other people will sort of let it go on for some time before seeking that extra help. And I think there's also that different variation and understanding when people can get treatment from which different services within the NHS. So, you'll find some people turning up to A&E, for example, where there's not really anything they couldn't have got at a pharmacy. They've left with perhaps painkillers even. And, it was just a case of they needed to either ride it out or wait a bit of time before seeing whether the illness is self-limiting or whether it will actually manifest into something more later on. So I think sort of the Joe Public come in quite regularly. They do ask for advice from the pharmacist as well, but they don't always understand what treatments they're able to access within the pharmacy. And just that sort of reassurance and education from the pharmacist side to be able to explain to the patient what to expect from their conditions, like how long should a cough last, for example, what's normal. People seem to think I've had a cough for a few days and this is something serious, I need antibiotics, but no, actually it's quite normal for a cough to last up to a couple of weeks even, and that's not anything that you need immediate treatment for. So it's just about that self-care advice, being able to look after yourself, being able to take painkillers and other things where needed, just to help you get through the condition. Because a lot of people are working, or the students, or whatever else it might be, and they need to go on about their life, so they need that bit of medication just to sort of help support them and put them at comfort while their body fights off the illness that they're suffering from.
And do you find that people are coming up to you generally last minute type of thing? Because it's that thing, I mean, we live in a bit of a rat race, we need to work, we need to pick up kids, there's a million and one things to do, and health kind of when the proverbial really hits the fan, that's when we kind of go and seek medical advice and so on. So is that generally the kind of pattern that you guys see at the pharmacy?
I wouldn't say so, no. Generally, we would see less of those individuals. We see more the people that are perhaps a bit more elderly, that are a bit more in tune with their health, a bit more conscious about their health, have a bit more concerns, maybe take different medication and need advice with that. So that's probably more of who we see. However, I do agree with what you're saying in the sense of there are individuals who leave it far too late, and we may have to then refer them to A&E or more urgent services, because they've got to a point now where they should have sought treatment maybe a week ago or earlier on within the illness.
Dr. Rashid, I mentioned at the top that I read somewhere that something like there's seen an increase of 45% of attendances that are not really appropriate. You work at the local hospital in Heartlands. What exactly is going on in A&E, and when should one call 999 and attend A&E? And tell us a little bit about, if somebody does do it when they're not meant to, what kind of pressure that puts on resources.
Sure, thank you for the question. And I'll start at the top in terms of attendances. So overall, as you correctly mentioned, there has been an increase in attendances across front doors throughout the country. But interestingly, actually, our activity around Birmingham and Solihull has, in terms of flu-like illnesses, increased by, I think, at least 10% more than the rest of the our neighbouring counties and regions, etc. And as you correctly say, I am a respiratory consultant in Birmingham and Heartlands Hospital, but also the executive director, so I have a very close eye on what happens across our front doors. And I can tell you that the hospital admissions related to flu have increased at a rate much higher than we've seen in the previous year, and almost to the level that we had back post-COVID, when we had the after our population came out of social isolation, etc. So that's a really important figure. And so today, this morning, across all of our hospitals, so that's Heartlands, Good Hope, Solihull and QE, we've got nearly 270 patients that are admitted with flu. And at Heartlands alone, as of figures from this morning, we've got 109 patients. Now, what is really important, and I'm glad you've asked me the question, what does this mean for the services? So we said quademic, and it's actually more complicated than that. So if you come to the ED department at Heartlands, what we're trying to do is to try and do the flu swabs and COVID swabs very early on, so that we can know what illness we are dealing with. And the reason for that is that we have to follow very strict isolation protocols. In fact, we have to separate flu A from flu B, from COVID, from norovirus, because of the risk of cross-contamination. Now, if you think about a confined space, which our ED departments are, and you think about the risk that patients that are sitting there that may not have flu, but have a genuine other illness, being exposed to someone with any one of those four illnesses poses on them, then I think you begin to understand the scale of the problem. So once we have ascertained that you need to be in hospital and we need to give you the relevant treatments, the added challenge that brings to us as a hospital is, well, how are we going to isolate all of these patients in a way that doesn't totally block the hospital? So on any given day, we will have a number of patients that have got various different, and some people can have more than one virus at one time. But what that means is that we have to block off certain beds. So there may be beds in the hospital that we cannot use because, for example, if you had a bay of 4 and 2 of them had flu A, you can't use the other 2 beds for the other patients because they've got a different strain. So it is mind-bogglingly complicated.
It's a logistical nightmare.
It is. And it's, I'm forever indebted to the teams that have to work with these conditions. So it goes back to the question, and back to that original conversation we had a minute ago, is how do you avoid the NHS from becoming overwhelmed and using all of the fantastic services that Dr. Bahel and Ilyas have spoken about, because these are services that are there to keep you well and keep you at home and to minimise the risk to the rest of the population. And that's the mindset we need to get into, is that, it's not just about you receiving the right treatment, which you absolutely will if you access these services, but actually what is the impact of me as a patient attending a very overcrowded ED department, and what does that mean? So inevitably, if you end up with a lot of beds blocked in your hospital and you're dealing with the kind of numbers of infective patients I speak about, there's going to be a consequence. And the consequence of that will be ambulance handover delays. It will be patients in the community that need emergency services not being able to access them in a timely way because we haven't been able to empty the beds for those patients to get through. Does that make sense?
It does. I want to ask a question here, and let an honest response would be appreciated, but you can keep it PC if you want to. When somebody does turn up, and they've literally just got a runny nose, and they turn up in A&E, what does your heart drop? Do you ever think, for goodness sake?
AD departments can never close, and never should they close, because that the whole point of having an NHS that is available and free at the point of need is what the ethos of the NHS has always been, and will continue to strive for it to remain that way. So we do have streaming services within our ED department. So we actually have GPs that work within the hospital building, not immediately within the ED department, where we can stream patients away from the very busy, crowded ED department. So programs like this that help awareness, I think, empowers not only the patients, but also makes a difference to us at the front door.
Well answered. Dr. Behl, question for you. Red flags. I want to talk about red flags and what should, as a concerned parent, children pick up all kinds of bugs when they attend school and nurseries. So what are some of the red flags for parents? And what about if you're pregnant? We mentioned it a little bit at the beginning, but can we talk about those two, please?
Yeah, sure. So, I'm a parent myself. I know what it's like when the little ones are ill. So I think if I could categorise them into two, so one I would call infant, so under 1 year of age, and then perhaps the older children. So in a young child under the age of 1, I think as a GP, the things I would be asking you around is any fever, any temperature. So any child with a temperature who's under the age of 3 months needs to be seen by a medical professional, and that's really important. So let's talk about the very small babies under 3 months. Any temperature above 38 degrees, you must come and see somebody, and we'd be very, very happy to see that baby. If they don't have a temperature, but things that I would be asking you about as a GP is primarily around their feeding. So you must remember they don't eat or drink anything else other than milk. So it's really important. That's their main source of energy, their nutrition. So I'd be asking you about their feeding habits. If we feel that they're feeding less than 50% of what they do in a 24-hour period, that would be starting to raise some alarm bells for me that the child is not receiving enough hydration. The other common thing is nappies. Are they making wet nappies? And again, if a parent tells me their nappies are severely reduced, again, that kind of makes me a little bit concerned. Obviously, if they're vomiting with diarrhea, they're going to be losing a lot of fluid. So young babies, if their feeding is off, if they've got a fever and their nappies are reduced or they're drowsy, these are the things I would be concerned about. In slightly older children, if they've got a temperature above 38 for more than 5 days, that's again a time when I would be encouraging you to seek some help. Or if you've got a temperature in a child and it's not very obvious, most of the time it's obvious their throat is sore, they've got a runny nose, their ear hurts, and then you can be more reassured that there is a reason for a temperature. But if there's no obvious reason for a temperature, then, or any rashes, if they've become more drowsy, and if they just don't seem right to you, and I think we must not ignore the parental gut instinct. Parents do know best. So, if you feel your child is off and you can't explain why, then again, we're more than happy to see you. And in pregnant women, I think, it's often these vaccines that we're giving is not necessarily to protect mum, but it's actually to protect the baby. So the RSV virus, there's the whooping cough virus, the pertussis virus that is offered to pregnant women. It's more for the effect on the baby because it crosses the placenta. So for pregnant women, because again, we would consider them at risk. So if you've got a temperature, you're feeling short of breath, you're coughing up any blood in particular, these things are very, very important and that you must come and see us. So I'd just like to reiterate what Ilyas said around a common duration. So as he correctly said, a cough can last up to 2 weeks. So any cough for more than 3 weeks, that's when I would want to see you. That's when I would be slightly concerned. And also common cold symptoms can last up to 10 days. Diarrhea and vomiting can last up to 10 days. So, patients often come and they've had a 1 day or a 2 day history. That's usually less concerning. So if it's been lasting, so just to reiterate, viral symptoms, cough and cold more than 10 days, cough for more than 3 weeks, at these points I would be asking you to come and see us and get checked out.
Ilyas, am I right in saying that you're a community pharmacist? Is that
That's correct,
that's
yes.
correct?
Yeah.
I'm just trying to put myself in the shoes of a pharmacist. Whenever I go to a shop, I'm always hearing conversations about what's happened, and you kind of hear about how this certain disease has been spread, or you hear stuff. So my question was going to be that do you ever come across conversations with customers and clients to kind of as to why they don't come forward to get jabs? And the other thing is that as a pharmacist, do you guys give out the jabs, or does one have to go to the GP first and then see you, vice versa? How does it work?
Well, for the flu jab has been quite widely available in pharmacies for some years now. The COVID jab you can also access in a lot of pharmacies as well, so as well as GPs and other vaccination centres. So both of those vaccines you can actually get quite widespread. I mean, in Birmingham there's hundreds of pharmacies and settings where you'd be able to obtain both of those vaccines. And in regards to the conversations that we're having with patients, you do again see a lot of individuals, like you correctly said, who have some resistance or hesitation about the vaccine. They've heard from so-and-so that it made them ill, or they're not sure exactly what's in it or whether they actually need it. And it is part of our role, absolutely, to explain to the individual whether they are actually eligible for it, so whether they need the vaccine, so are they vulnerable, would they be able to obtain it, and then just being able to explain to them what the benefits are of that. So some people think, I never get the flu, or I'm young and fit and healthy otherwise, but it's to make them understand, if you have certain health conditions, it just puts you at risk. So if anything, even if you were to contract the virus, it would just mean you suffer from it less. So there's not really any, in terms of the harm that comes from it, it's very, very little, if anything. The common side effects, which we would always tell people, is the heaviness in the arm, and then just feeling a little bit run down perhaps for a day or two, which is just your immune system sort of reacting to the actual vaccine. And that doesn't mean you're getting ill, that's just your body's normal reaction to the vaccination. So I think definitely a lot of conversations we do have are quite key in just explaining to people, because there's a lot of misunderstanding. People still don't understand what COVID is, what flu is, and whether they need to be protected against it. And then the other thing is to understand, even if you're healthy otherwise, you may have other individuals which are in your family, or that, depending on your work setting, that you come across on a daily basis, and you may pass that virus or illness onto them. And it's just making them aware, again, like both the doctors mentioned, about prevention before looking for any treatment or cure. Taking those preventative measures are quite crucial in stopping the spread of a lot of these viruses and illnesses.
And in this time of the year, in the winter season, what kinds of symptoms are you seeing people come in with? Is it generally a cough and a runny nose, or does it?
So I'd say sore throats, generally feeling unwell. Runny noses, coughs are quite common as well. Blocked noses are quite common. Vomiting and diarrhea probably a bit less than the others, but all the above, on a daily basis, probably depending how busy the setting is, the pharmacy is. You get multiple people per hour that would come in with the same exact symptoms over and over again. So we're very much aware of sort of what to expect as well.
And are you somewhat surprised sometimes just at the misconceptions between COVID and flu, and where do you think that kind of comes from? Because obviously we went through a pandemic, and so you'd have thought, the difference between a flu, cold and COVID would be abundantly clear now, but maybe it isn't. And do you know what I mean? Are there still misconceptions there?
Definitely. So I think it depends where you get your information from. There is a lot of people who maybe speak to people they know or use social media and things and don't always use the correct source of information. A lot of people are skeptical as well about the information that they receive from different health authorities. So it's just about explaining exactly what sort of conditions they are and what symptoms you get, and then what the evidence is behind it as well. They may have a certain belief about something, but there's no evidence towards that, perhaps. So it's just sort of exploring those ideas with people and just explaining what the facts are, I think.
Thank you. Dr. Rashid, I mentioned at the top there, quademic, as it were. Flu, COVID, RSV and norovirus. Now, you've got the unenviable job of trying to give me the symptoms for each one. How do they kind of differ, as it
So
were?
the first thing to say is that other than norovirus, the other three are very similar, and there's a lot of overlap. So it's very difficult to differentiate which one, which is why when we have patients with the symptoms of cough, cold, fever, sneezing, aches, attending hospitals that we think may need admission, we're very quick to try and differentiate which virus it is. We do that through testing. So actually, I would say, I think it's quite difficult for the general public to be able to differentiate which one of the three they've got. Norovirus, as Dr. Behill has already explained, is much more of a gastric, which means a stomach bug. So the symptoms are more related with diarrhea, vomiting, and stomach cramps. So that's a bit easier to differentiate. And I would take this opportunity to say that norovirus is self-limiting. And that is definitely one of the viruses we would not want to enter the hospital, because it particularly causes a lot of problems in our elderly patients, who it can lead to dehydration and various other problems. So actually there is very little reason why anybody with norovirus who's young and fit would need to come to hospital with those symptoms. I don't know, Natasha, if you
I would
agree
agree.
with that.
Yeah.
So that's definitely one to stay in the community, because the likely potential harm to ill patients is great. Flu virus is the one that we're particularly worried about. Like I said, we have got some patients in our ITU departments currently with flu, so it is an illness that can lead to pretty significant complications, such as pneumonia, for example. And it is difficult to give very specific advice about when you should or shouldn't come to hospital. So my colleagues have explained the type of patients they would see in primary care and in pharmacy first. And I think for patients out there who have these overlap symptoms, it is about those patients who've got pre-existing conditions. Those are the patients that we're particularly worried about. So that would be immunocompromised patients with COPD and asthma or other heart conditions, etc., who are not getting better after 4 or 5 days. The fever is just not getting better. Breathlessness, if you're more breathless than you usually are, and remember, patients with lung conditions have a degree of breathlessness at baseline, but patients know themselves. They know what their baseline is. Even young and fit people can be breathless, and they do also have the propensity to develop complications. So it is about what is your baseline, and are you worse than your baseline?
If you're using your inhaler more often.
Absolutely.
So
exactly, absolutely. So it is about actually, hospitals are for the very sick. And I think that's probably, if you are feeling, despite 3 or 4 days of all of the other, and you've accessed everything and you're still not better, those are the type of patients that we need to be seeing in hospitals.
I like the way you put that. So it's not a last resort, but it's when you're very sick, as opposed to I'm not feeling very well type of thing. Question for you, Dr. Behill. Being a GP, having your practice in Solihull, how does, and I'd imagine you get this every year, a spike in the winter. So how do surgeries, or how does your surgery prepare itself for the winter? I'm sure it's kind of all hands on deck type of thing, but how does that manifest?
Yeah, excellent question. So the flu campaign and COVID campaign planning actually starts in January of that year. So it's a mammoth operation, particularly where I work. We are the largest group of practices in Solihull. So we actually start that planning in January. So by the summer, we have identified the patients that are eligible for vaccines, and we started our first clinics by the end of September. We'd actually want to start it earlier, but we are limited about when we actually get the delivery of the vaccines. So that is a rate limiting step for us. So there's the whole campaign bit, which is flu vaccinations and COVID and RSV, which is a vast majority of our work. So we actually offer a lot of weekend appointments, evening appointments. I was on clinic last night, for example, giving vaccinations. So we prepare for that logistically and operationally. With respect to the acute illnesses, our workload does shift. So you may find this time where GP surgeries are offering more acute on-the-day appointments, and our routine routine work, our planned care work does have to take a bit of a pause in order to be able to manage the more acute care. There are also things available in the community, which are new sort of hubs that are up and coming, winter respiratory hubs. There's sometimes winter pressure hubs where there's extra capacity, what's known as surge capacity, and Dr. Rashid will know all about that, about things that they do at this time of year to try and increase the access and resources for patients. So that's how we really plan as a GP surgery, knowing, as you say, this is no surprise to us. We know it's coming every year. We're also we're mindful of our staffing levels at the time. But again, we haven't said it, but we as health professionals are also vulnerable in the environments that we work. And sadly, we also see a lot of sickness of our staff at this time of year as well. So it can be particularly challenging. So, I'm sorry as a patient if you've had your appointment cancelled recently because we've had staff sickness, then I apologise, but ultimately we are also equally as vulnerable to these illnesses.
And Dr. Rashid, can you tell me a little bit more then about this surge capacity and these hubs?
So yes, and as Dr. Bell has said, the planning for winter starts in summer really, and in terms of what we do from a hospital perspective, and then I'll come on to the hubs as well. We have across all of our sites opened extra winter capacity within the hospital. So that means we have to find extra clinical space, and at Heartlands we've opened another ward to try and help manage the demand at the front door. And that's a mixture of everything that comes through winter, but flu and respiratory illnesses are the bulk of our work at this time of year. And again, as Dr. Beale has said, there's a huge that's a huge task to suddenly open an extra ward because you need to do staffing as well with it, etc. And so those are the in-hospital measures. We do admission avoidance. We have opened extra GP capacity, as I mentioned before, within the hospital, trying to stream patients out away from ED departments. And then in the community, we have opened some extra paediatric respiratory capacity to help deal with some of the children that Dr. Mahill and her colleagues see, but also extra adult capacity as well in the form of respiratory hubs. So there's one at Solihull, and we're developing one at Washwood Heath as well. So it is a joint effort between the community services and secondary care services. And again, I mean, my only plea to listeners out there is please help us because we do our very best in terms of expanding our services and trying to minimise risk to our patients. And I should mention at this point that across I think almost all of our hospitals, in fact all of our hospitals, we've gone back into mask wearing, so patients will see that the patients and staff are being asked to wear masks in at-risk areas, and I think it's a very poignant message, and we have seen actually an upturn in staff taking up the vaccine as a result of this, because all of a sudden it becomes really real.
I think that's it kind of takes you back, doesn't it, to the pandemic and making it, as you said, real. Question to you, please, Ilyas. I mean, similar vein. As a pharmacy, how do you guys prep? I'd imagine there's stock overload, as it were, at a pharmacy. But what kind of measures do you guys take during this season?
Yeah, well, similarly, we have to start sort of at the beginning of the year to plan for. So January, February, a lot of the time people are sort of ordering their vaccines and preparing themselves for the winter cold and flu season. In terms of the added pressure of the vaccination programs, a lot of it that is incorporated into the daily work that happens within a community pharmacy. So it can be very time consuming. It can be quite high pressured as well. So, we have to sort of calculate and make sure that we have enough staff present within the pharmacy to be able to continue to do all the pharmaceutical work that we do with prescriptions and medication, still be able to make time for the services, these new services such as Pharmacy First, and, just being able to give patients that time and care, and then also trying to run the vaccination clinics alongside that. So, it does present challenges, and it is something we have to sort of prepare for at least several months in advance to ensure that we're able to continue to provide the services, because as you can imagine, if you have a bad particular day, you can fall behind quite drastically, and then it can mean people get delays in their treatment, vaccination cancellation. So, it does have definitely a knock-on effect. And as Dr. Bahal just mentioned as well about staff illnesses, it's very very much a difficulty at this time of year, because, you know, a lot of pharmacy teams people see are quite small. So if it's a fairly quiet community pharmacy, you may only have a couple of people working there, and one individual being off sick is quite detrimental to just the operation on a daily basis. So yeah, I'd say to the public, just try and be patient with us as well. We do try our best, and we try to accommodate as much as we can.
You guys have mentioned staff sickness a couple of times, and I was reading in an article just a couple of days ago that NHS staff sickness was also up by 10%, I think it was, due to the quademic, and as a service, it hasn't even peaked yet. Does that somewhat alarm you, Dr. Rashid?
So, I mean, as we've discussed, it is part of the flu pandemic and the rest of the quademic, which is why we really push for flu vaccinations and COVID vaccinations, and have done since when they became available. So it is about prevention. It goes back to prevention, isn't it? So it's staff vaccination, it's about good hand hygiene, it's about mask wearing, it's about staff being vigilant to their own symptoms, making sure that they are taking all of the infection control measures that they need to when they're looking after patients with flu to try and minimise that risk. So does it alarm me? Well, it worries me, because we need healthy staff to look after our patients, and it's the message is that for patients as well as staff is we have to help ourselves to enable to help the NHS.
Coming towards the end of the show, Dr. Bahel, can you just one final time break it down? When does an individual come and see you, and when do they go see Ilyas? What are the sort of things to look out for?
Yeah, absolutely. And it's not always easy to answer these kind of questions. But I think with Ilyas and the Pharmacy First services, I think those 7 conditions are key. So just to reiterate that they can help, and they can even prescribe antibiotics if needed. And if the Pharmacy First team don't feel that patient can be managed in their setting, they have a way of referring those patients to us, and we will pick them up on the same day. So just be reassured that if you are being signposted either by ourselves as GPs, or you choose to go to Pharmacy First and it's not appropriate for some reason, that we will still see you and we will still look after you. So you're not being fobbed off, which is often a feedback that we receive from patients. To come and see ourselves, obviously if you've got very young children under the age of 6 months and you're worried about their feeding, any fever, their nappies, they just don't look right, then we're more than happy to see. And for me, as a GP, as I said, if you've got a cough for more than 3 weeks, which is relenting, it's not improving, or you're becoming more breathless in that time, or if you have a fever for more than 5 days that is not settling, it's not responding to simple paracetamol or ibuprofen type things, that's when we'd really want to see you. And of course, and if you've got an underlying condition, you're immunosuppressed, or you've got a heart or lung conditions, and you feel that despite simple measures, things aren't improving, then to come and see us. And of course, children also have underlying health conditions as well. They may have congenital, what we call heart conditions that they're born with, or underlying chest conditions. So again, very low threshold for us to see children like that.
Ilyas, final message from you, please, sir. People always, that mindset, the old mindset, as it were, always want to see a GP first, but you guys do a fabulous service, of course. So your final sales pitch, sir.
So what I would say is, of course, we have these 7 conditions as well, but we're not sort of limited in being able to give advice and treatment. And if an individual is ever unsure, somebody's got minor illnesses, minor problems with their health that they're sort of concerned about, they can quite easily come and speak to the pharmacist, and we're able to pass you on, signpost you to whatever other service it might be. So if you are sort of unsure which service to even access, you can quite easily come into the pharmacy, and if it's something we're able to support with, we will. If it's something we need to sort of refer you on towards to a GP or to a different sort of health setting, then I definitely think it's worth coming into the pharmacy for that. Also, as a pharmacy, you will see a lot of prescribing pharmacists now as well, and they're able to give further treatment. So, it might be that you can't see a GP, even you've been referred to a GP, and you need something that day, or somebody may be working and only free at certain times. They're able to come into the pharmacy, and there will be prescribing pharmacists available in some pharmacies, but that's sort of select as well.
And last word from you, please, Dr. Rashid. What should we be doing this winter?
So look after yourself, look after your family and loved ones that are at risk, and help us look after the NHS.
Thank you very much indeed. Dr. Bahel, GP from Solihull, Dr. Rif Rashid, respiratory consultant at Heartlands, Ilyas Community Pharmacist, thank you very much for taking time out, folks, and telling us about the quademic and what we ought to be doing, vaccinations during this winter season. If you have any questions, queries or concerns regarding this show or any other show on Unity FM, then remember you can contact us 0121 772 8892, or you can email us studio@unityfm.net. Until the next time, please take care. Assalamu alaikum.